Hello everyone, good afternoon, good morning and good evening. Welcome back to my channel. My name is Olashade Talabi. I'm a medical doctor. On this channel mostly I talk about my experience as a medical student in Poland. But I thought since I'm no longer a medical student or since I'm no longer a foreigner in Poland, why don't I branch out into other things that catch my interest? And so as you can tell by this topic, I'm going to be talking about a medical condition that is actually quite common amongst females, but it's not well talked about or not well explored, and this is called vaginismus. Now, what is vaginismus? According to Google, it says vaginismus is a condition involving a muscle spasm in the pelvic floor muscles. It can make it difficult, painful, or impossible to have sexual intercourse or undergo a gynecological exam or to insert a tampon. So what are the causes of vaginismus? Various causes actually. Maybe a lady has been raped or had sexual abuse or trauma in the past, and maybe the person has had a past painful intercourse or emotional factors actually. And this is usually a diagnosis of exclusion, which means that after a medical practitioner has checked you and seen that there is no other thing that can be causing painful sex, no physical barrier, no physical hindrance, then the next thing that is thought to be the cause of this is vaginismus. What is vaginismus basically? It's this involuntary contraction of your pelvic muscles, causing it impossible for you to have sex or to have anything inserted through your vagina. And so it's either painful or totally impossible. It means your vagina was totally clamped down and contract so hard that even you cannot voluntarily relax it. That's how I know it's kind of weird to think about it, right? For people that have sex just subconsciously even. But yeah, it's quite common and it happens to a lot of women. I saw someone comment on someone's page on Instagram, and that got me thinking that, oh, I need to talk about this because it's actually quite common. Surprisingly, it's very common. Most females have painful sex and they do not know that this is the cause. They just think, oh, maybe I'm either, there's this notion amongst people that, oh, I may either have a small vagina or a tiny vagina or something. But yeah. So how do you know you have vaginismus? What I would say is if you have any of these symptoms, so if you have painful sex, or you've never had sex and this is because it is impossible for your male partner or anything to penetrate through your vagina, and you usually have this clamping down of your muscles, right? Your legs are contracted, your thighs are contracted, you have this insane fear of having anything go into you, I would suggest you see a gynecologist. Now, for them to diagnose if you have vaginismus, you obviously have to be examined to see that there is no physical hindrance or physical barrier as to why you cannot have sex or as to why your sex is painful. So when you've been finally diagnosed of vaginismus, the next thing is to visit a pelvic floor therapist. Now, they're not as common as they are in the Western world in Africa, or I can say for Nigeria. In fact, I've not come across any pelvic floor therapist. But there are things you can do if you exist in Nigeria or if you live in Nigeria and you have this condition. And one of the things you can do is doing this thing called progressive dilation. Progressive dilation is the introduction of small barrels or small progressive sizes of barrels through your vagina so that your body can get used to having things inserted into it. So you can buy these dilators. They have them on Amazon, I think, and they have them on eBay as well. So I got this pack from Amazon. I'll leave a link down below. It came in really quick actually. Within 2 weeks, I received it. It is from this company called Femax. I don't know if you can say it. Femax. Yeah, and it's not that expensive actually. But this is made of plastic. So this is a dilator and it's made of plastic. And you can see it comes in this barrel shape. There are other ones too that are made of different materials like silicone, which I advise actually. I actually advise you to buy silicone material because unlike silicone, plastic actually makes bacteria stick and bacteria to grow. right? So it's not actually a very good thing to use. But if you have no option, you can. And I'll tell you what you can do to actually prevent that infection or that bacteria thing. But first of all, I'm going to show you what it looks like. So it comes in 4 sizes. Some have 5 sizes actually, but this come in 4 sizes. And as you can see, these are the 4 sizes. So 1, 2, 3, 4. These I think are actually good, but I believe there's a big jump between these two. So you can see there's a big jump between these two, and there's a huge jump between these two as well. I would think this should have at least 6, but it's all good. So what you do is, in the beginning, you start inserting this. This is quite small. You start inserting this, and when you get comfortable with this being inserted, you go on to the second size. Now, the time for you to get comfortable with each size depends on each person actually. It can take you a week, it can take you a month, it can take you I don't know, 3 months, depends. So what I would just say is listen to your body and just know what you want. That's basically it. So when you get accustomed to the first size, you go on to the second size. Now, what you can do to make sure that this is clean, so the thing I'll suggest is before you use it, you wash it and wipe it down. But one other extra measure you can do to prevent getting infected or carrying infection is wear condom for each of these barrels. So you can buy a pack of condoms from the pharmacy, from any store. They're quite cheap, any type of condom. So sorry, my battery cut off. So as I was saying, for each time you want to use this, you take a condom and you wear it for each barrel and you dispose it, right? And this will obvious, and also this aids in the lubrication because most condoms have lubricants on the outside. So yeah. So okay, so something else as well, if you maybe have vaginismus as a result of emotional issues, it will be good if you visit a sexual therapist or sexual psychologist. There are not a lot of them in Nigeria, but there's a very good one, and I would put her Instagram handle down below. She's very good. I see a lot of testimonials of people that are dealing with this issue or dealt with this issue, and she's helped them through with it as well. So that's something to look out for. All right, please subscribe. I'm trying to get up to 1,000 subscribers and just let me know what kind of videos you would like to see, and I'll definitely upload. I'm trying to do once a week now because I just started a new job and I cannot upload during the week anymore. I mean, I cannot record videos during the week anymore, but I can upload. So just let me know if there are any ideas or anything you would like me to talk about, and I will do it. Thank you so much for watching. Have a lovely week. Bye.